Hello, everyone. Meeting should be starting soon. We're just waiting for a few more people to come in.
Hi, everyone.
Hello. I think everyone should be joining in now. Just gonna. All right, here we go.
Afternoon, everybody.
Hi.
Good afternoon.
We'll give people a couple of minutes more because I think people are still arriving.
Yeah, Richard, I tried to contact Bindi's PA. They're out of office and
That's okay.
yeah.
I'm assuming I'm sharing unless Bindi turns up.
Sorry.
That's fine. No, it's annual leave season, isn't it? So
yeah,
that's fine. And I can see we're recording as well, so we can. So just so people are aware. And we are up to 14. I'll give people another minute or two because I think normally arrive sometimes a little bit late. And we've got a reasonably busy agenda, haven't we? We've got some workforce updates. We've been asked to submit a bid to the GLA for a social care academy. So really, so that'll be a substantive item. That's particularly looking at how we get residents onto health and social care courses that meet the needs of providers and then get them into jobs in the sector. So really keen to hear people's views of how we can do that better. And then Phil, you're going to talk about fair cost of care, aren't you? So a couple of kind of core items.
We may not need the whole hour. Sorry, Richard. We may not need the whole hour and a half, but we'll just see how we go.
Great. Well, I think we should get started. So for people who don't know me, I'm Richard Taylor-Alphick. I'm the Programme Director for North London Council's Joint Areas of Work, of which of Workforce is one, which Naomi leads. I'm going to suggest, because of the numbers, we don't all do individual introductions, but it'd be great if there'd be chances for questions and there'll be breakout groups. So it'd be great if in them people can introduce themselves, or if you ask a question, if you could say who you are. But we'll go straight into the agenda. So I sort of trailed. We've got some workforce bits and some bits on the fair cost of care process. Naomi, you're going to present some workforce updates, aren't you?
Mm-hmm.
So over to you.
Great, thank you, Richard. Hi, everybody. I'm Naomi. I'm the Workforce Development Manager in the North Central London Adult Social Care Programme team. I'm hoping you can see the slides. Let me just Try and make them bigger. There we go. Even got fancy writing. Just a summary of the presentation today. I'm going to look at some of the updates since June 2022 when we met last time. I want to talk about the recent workforce survey, which hopefully lots of you have already seen, the Prince's Trust, as Richard mentioned, the Social Care Academy, and then following the breakout rooms, Phil's going to talk about the fair cost of care. So in terms of updates, I know that we have discussed some of the digital projects before. So the main things are the acoustic monitoring project, which is due to be rolled out in care homes and is a piece of technology that is able to monitor and listen out for falls. So at the moment, the procurement has been done, but we are awaiting sign off. So we will give you an update as soon as we can. And the other piece of work for digital has been like digitising social care bid, which was successful. This is looking at a few different areas. So one of them is shared care records. And there's also some provision in there for technology in the community as well. So a couple of different areas that we're going to look at. And once we have more information, we will let you know. In terms of recruitment, as you know, we're always recruiting on Proud to Care North London. I think at the moment we have approximately 27 jobs on there. And as always, we're keen to keep that up. If you ever have any questions about advertising on there, you want more information, please let us know. We can put our emails in the chat, and Nathan is the go-to person for that. Regarding Proud to Care North London, we've been working alongside our colleagues in the Islington GP Federation recently. They're doing a really big piece of work on uploading more information about training, specifically around like certain conditions. So there's going to be a sort of best practice guide on sort of signs to look out for urinary tract infections, pressure ulcers, signs of sepsis. There'll be catheter management and stoma care information on there as well. The project is being led by our colleague who is a GP, and he's working very closely with the training hubs as well to deliver that. So when we're going to launch that, we will let you know, probably via an e-bulletin, and it would be fantastic to get some feedback on that as well. In terms of wellbeing, I'm really keen that we continue to signpost people to the NCL Keeping Well Hub. I'm due to do some work with them around how we can try and incorporate referrals to that service as more of a business as usual pathway. I don't think the referrals have been particularly high, but it's just important to stress that it would be great to discuss it with people in the office during one-to-ones. I'm sure we can get some marketing material as well for your offices. So do let me know if this is something that you're interested in. So the workforce survey, Nathan has been working very diligently on this. And I'm sure you've all seen that this has been launched, and we've had a really good response so far, but I think the more the better. So the aim of it is to gather the current information from you as our providers about your statuses in recruitment, training, employment, and also wellbeing. I think there's about 30 questions in the questionnaire, but don't let that put you off. It should be relatively straightforward. And what happened with last year's workforce survey is that it directly impacted my workforce plan. So we took the top three things, the top three areas that we were looking at as a result of the survey, and that's all been fed into the plan. So it's really important that we have maximum participation so that we can get accurate data and that we can understand the trends, we can analyse the data and interpret it appropriately. It also supports us to raise funds into the sector, and the results also support organisational strategy as well. So in the last box, I've just added the link for the survey. So if you haven't already completed it, please do. And I think it will be available for a few more weeks, and we can clarify that as well. So the work that we've been doing with the Prince's Trust, I'm pleased to say, has been going really well. We had a cohort in June where we worked with the Royal Free Hospital on getting people into health and social care worker roles. Sorry, healthcare support worker roles. And out of 6 people we put forward, 6 were all offered jobs, which is fantastic. And in August, we worked with UCLH and also with Certitude Care. And I think we had 7 out of 8 who were successful. So again, really, really good examples. And I think we really need engagement from you as social care providers. I mean, it's a fantastic opportunity to get involved with direct recruitment. So the Prince's Trust, as you probably know, works with young people who want an education, employment or training. And Ronke does a fantastic job, and I've sat in on some of her programs. She gets people up to a really good standard to go forwards for employment. And she does lots of education around like myth busting with social care, because I think a lot of her role is about educating people that health and social care is a good career to go into. So if you would like to be involved, there is an upcoming cohort in September, and there will be another one in November, and then more next year as well. So please do email Ronke or myself. And yeah, it's been really, really positive so far. So I think we need to keep up the momentum. And the last thing I want to talk about, but probably the most important, is the recent Social Care Academy. So this is from the Mayor's office, and it's going to be funded by the Greater London Authority. So there's been an equivalent. There was a previous bid submission which included a health hub, and this has been awarded to Sorry. Don't know what that was. Anyway, so Islington have been awarded the health hub. The aim of the hubs is to support people who have been sort of disproportionately affected by COVID, and also to access our sort of more underrepresented groups in the community and enable people to get into education in a further education college, do a social care course or health and social care course, and then go into employment with our care providers. So it's going to involve co-design of the health and social care courses with the colleges based on the needs of providers. And I think we will be looking at things similar to the care certificate, so gaining a basic understanding of the skills needed to go into entry-level roles. So we're hoping that it will become a sustainable pathway for employment. So we are looking to providers to be formal partners with us. So far, I've had really, really good engagement from those who I've emailed. It's a fantastic opportunity to A, work with the further education colleges, and B, hopefully get this, constant stream of people coming through from a short course into employment. And hopefully there will be some level of in-work support as well, but we need to discuss the detail on that. So yes, a big ask of you all, please, if you're interested, we'd love to hear from you. We do have a relatively quick turnaround with this because the bid is due on the 9th of September. So if you could, I'll put my email in the chat, but we are going to discuss this in the breakout rooms as well. But if you could please contact me, preferably by next Wednesday, that would be fantastic. And just to help with your understanding of the model, I'm just going to run through the model of delivery. So the first step, as you can see, is around the North Central London resident engagement. Sorry, I should have said this is for local people in NCL. So this is going to be a big bulk of work, which is going to involve marketing. So we need to make sure that we're targeting people who we want to get into the academy. So this will be targeting people from underrepresented groups, as well as people not in educational training. And there's lots of different mechanisms through which we will be able to do this. So we're working very closely with our economic development partners, and they work closely with job centres as well. So we're hoping to market to the correct audience. The second step will be getting people into colleges to enrol on the health and social care, most likely level 2, level 3, but the courses will be designed by both colleges and yourselves as providers. After successful completion of the course, we hope that this will lead to employment in a social care setting. And as I mentioned before, we're looking at a sort of mentoring model and roles in work training and support. And then the last stage would be development to support progression. So, you know, we really hope that people will come in at entry level, will work hard, will demonstrate that they have the right skills for the sector, and then they may progress to senior carers, perhaps then to care coordinators or registered managers. So we really want to upskill people whilst they're in your organisations. So in terms of what it means for providers, tailor making the courses for the students, it's vital that we have your input into the skills that you feel people need to then come in to work in your organisations. And as I've mentioned, it will hopefully mean you will have a pipeline of recruits coming into social care on a regular basis. So yeah, I think it's going to be really positive, and we're working very hard. So we should, yeah, the bid will be submitted on the 9th of September. If people could please get back to me as soon as possible, that would be great. And I think once I've got a group of providers who are interested in partnering with us, then I'll arrange a meeting with everybody and we can discuss it in further detail and you can ask any more questions. But as I mentioned, we will also discuss this in the breakout rooms a little bit later. In fact, now I think, sorry. Yeah, so I think that's all from me. Thank you.
Thanks, Naomi. Can I ask, in terms of what we'd be looking for from providers to be partners, are there particular things that you'd want to flag as areas?
Do you mean in terms of signing up?
Yeah. So I guess as I understand it, the academy model is looking to get a change in how we work between local authorities, the NHS, training providers, and social care employers. So I guess did you want to say a little bit about what you're looking for from social care employers?
Okay, yeah, so we'll be looking for people who are willing to engage with us and also with the further education colleges. So I think at the start there will be quite a big role for providers to come forward and really voice the types of things that you want to see the colleges producing. And it might be that you have learned experiences already from different courses. And I guess what we need are all of those, the learning from that, and to make sure that everything is covered. So there will be a role for providers to have a voice in shaping the delivery of the courses, which I think is key, because at the end of the day, you know, you're best placed to know what you need as employers for people coming into your organisations. And then hopefully, I think once they're established, we will need to review those, possibly on a quarterly basis. But then the role of employers, fingers crossed, will be doing interviews and onboarding and hopefully progression. So I think those are the main roles that the providers will have.
Great, thank you. And so we're going to go into breakout rooms, aren't we?
Yeah, sorry, we're doing that straight away actually.
Yeah, so hi everyone. I currently have 2 breakout rooms assigned. Would that be okay? Okay, I will open up the breakout rooms. There are 3 questions. I'll try and put them out in intervals. So you'll have about 5 minutes for each question. Okay, I'm opening them now. Hopefully you should be moving over.
I've put my email in the chat for anyone who wants it. Sorry, I'm just catching up with the
Oh my God.
Oh, for some reason you guys haven't moved over. Just give me a second. Let me just make sure. You try now, and Yvonne, you might be able to get a notification. And Park Lodge, just give me a moment. I'm working on you. Elm Park, are you there?
Yeah, I'm here.
Ah, sorry. Did you get a notification to move or anything?
No, nothing's come up.
Okay. On my list, it says you're in a meeting, so I'm trying to just, yeah, it says you're in one of the groups, so I'm trying to just figure it out. Hold on. Is that, so I'm just going to find out. Hopefully you should get, oh, sorry about this. I'm just having a bit difficulty. Yeah, for some reason, it's not letting me swap you over. Hopefully you should get a notification now. If you just bear with me, I've got to just talk to the other groups.
only have one laptop in this room as well.
So I can see people are joining, but is everyone back, Nathan? It looks like we probably is everyone back.
Looks like it.
Yeah, that's pretty much everyone. I think everyone, like some people are filing in, but all the rooms are closed.
Great. So we had, I thought it was worth just doing a quick bit of feedback. We had a really helpful conversation with actually quite a lot of detail across some of the issues that providers have found. I think definite interest in working with training providers to shape courses. So making sure that we kind of prioritize how that works. Some views on kind of what the asks can be around placements and how that can be quite difficult to resource sometimes. So think about, can we be creative? Can we feature parts of care that don't always get shown? So some of the things like the use of technology could be part of what we do to attract people to the sector. Some challenges in terms of things like clarity and indemnity. Can we support people with kind of IT and digitalization skills? Definite support to sort of prep people for things like interviews and what, particularly for younger people, what it's like to be part of in a working environment that maybe we can take for granted, but actually a bit of training around that can really help people. And people also thought, as well as kind of care roles, actually there are recruitment challenges in catering, in activities coordinators, or even combined activities and care roles. So one provider is looking at that at the moment, administration and kind of housekeeping and domestic. So there were kind of quite a lot of different angles there. So I thought there was lots of potential, and clearly a lot to do with what isn't masses of resource, but I think much needed. Naomi, I asked people to contact you to kind of formally partner and to follow up on the detail. Do you want to say a little bit about your group?
Yes. We also had some really rich discussions, quite similar as well to yours in lots of ways. So we talked about the fact that there are actually lots of non-clinical roles and sort of how we enable people to access those. I did mention about the work that Ronke is doing as well, because I think there has been some mention in her cohorts about non-clinical roles. So that would be another way to link people in with potential employment. And then we talked a lot about the care certificate, and that this does give people like a foundation in, care, but often what holds people back is the written work, the actual coursework. It seems to take quite a long time. So I think that gives us a discussion topic to take to the training providers, just to see what can be resolved around that, and how that works. And then also we talked about English not being always a first language, and what support there is in place for that, and people being able to access the academies. And I know that Haringey Adult Community Learning has got a very strong ESOL programme. So I can link in with them and get a little bit more information about that. And we talked about student placements as well, interestingly. And a couple of people in our group actually do have a little bit more of a hands-on approach with the students. They do get involved more with, say, moving and handling after they've had training. So I thought that was quite interesting. So that gives me something to build on in the work that I'm doing around student placements. So yeah, it was really useful conversations. So thank you, everybody. I've got some notes. Phil's got his hand up, so I probably forgot something.
So just one thing to add about mental health and resilience training, and where we can incorporate that as part of the training offer as well. Really important support staff so they have good mental health and well-being throughout their career to kind of start it from day one.
That was really important. and something that I don't think is being offered at the moment. We have access to the Keeping Well NCL hub, but in terms of teaching people around, I think it was the framework of sort of looking after themselves. Then I think that's something that we can definitely liaise with the colleges about. I think it's critical to success in health and social care, pre and post pandemic. So yeah, thank you, Bill.
So I think that's I was really pleased to see so much engagement and enthusiasm in this. We think it's really exciting and much needed. We'd love there to be more resource so we could fill every gap. But I think from what people have said today and conversations we've had at previous forums, I think kind of key things around making sure we do even more to sell the sector. So can we do some, can we put some resource about building more case studies, really featuring the range of roles from different providers and the kind of breadth of the role. I do really recognise the mental health and resilience point and keeping people well, but when I talk to people who work in other areas like hospitality, the kind of the treatment and the value people get from the work isn't the same as care, and I think there's really something positive to sell that we can keep doing better on. And I think then the absolute core bit, I think, is having some capacity to broker with care providers around what are the numbers of staff that they need, what types of roles, and have we got the training courses to do that. They were the two things I was thinking. If we can only do two things, they feel like the right ones to me. As you work this up, you might find that there are some variations or other things people want to work on, but I'm just really aware that the money won't go that far. So trying to listen to what people said and think what would make the biggest difference. If anyone violently disagrees with that, though, do say, and as they do, also contact Naomi to be a formal partner in this, because I would love North Central London to be the area that had the most care provider partners, because I'm determined that we'll get just as much out of this as Health will in their academy, and we've got the basis of a really strong partnership here. So that was workforce, and I think we're going on to fair cost of care, aren't we, Phil? I'll
share my screen.
Yeah, we can see it.
Perfect. So really just here is a bit of a reminder about what we're doing at the moment and kind of the input that we need from care providers. So there's the Market Sustainability and Fair Cost of Care Fund, which links into our social care reform that local authorities need to complete. As part of this, we have to complete cost of care exercises for care home supporting people aged 65 plus and domiciliary care agencies supporting people over 18 plus. As part of that, we have to complete a cost of care data table for each of these services. So no doubt your local commissioners have been contacting you, requesting data. It's for care homes, it's through the IE's tool, which is the online care cube tool. If it's for domiciliary care, it'll be through care analytics and the survey that's to complete. So really just a reminder that if boroughs are contacting you requesting data or requesting kind of clarification on the data you've already submitted, please do respond in as timely a way as possible. We're really keen to get as many providers as possible responding to this, so we have a really robust set of data that then we can then use to inform this fair cost of care. One of the other things that councils need to do is develop a market sustainability plan. So this uses the data you provided us to kind of identify the risks and opportunities in the local market, really just kind of identify what the care market will look like moving forwards. So the draft has to be done by the 14th of October, and the final plan has to be in by February 2023. So we're working to fairly tight timescales here, which is why the requests are coming from boroughs. So again, really just a request that if information does come to you or a request is made, please do respond in as timely way as possible. And this is just a little roadmap which shows kind of what we have to do and where we're up to at the moment. So a very brief presentation. happy to field any questions that people have over fair cost of care or any reflection on the process so far.
So while people think, I might say a couple of things so it's a kind of, we know there's a new government requirement. There is some new money. I think when the government identified that they wanted to do this, we didn't have inflation running at 10 or 11%, and the new money even at that point wasn't a lot. There will be I think discrepancies between where boroughs want to get to in terms of fair cost of care, or what the fair cost of care level says, and what's possible and the speed with which people can move there. So I think it won't be a kind of overnight movement. So I just wanted to make sure we're just really open and honest about that. There's an awful lot of feedback going from the directors of social services nationally about the burdens on social care currently and the need for more sustainable funding to support this. So I thought it was just important to kind of set some of that out. Within North Central London, we've had a policy position for care homes that we try and pay a rate that we believe is sustainable for each individual home, and we don't assume any self-funder subsidy. So we wouldn't, as councils, knowingly underpay. So we think we're in a better position than many parts of the country, but with inflation at where it is, the changes to the cost base of care homes are really moving. And we also know that we have a very complex resident profile going into care homes, because we support people with higher needs at home than other areas generally. For us, it's the first time we've taken kind of the same approach collectively with home care. So I think we're going to learn a lot as 5 councils, each making their own decisions, but sharing and learning and taking certain steps together around home care. So I'm really excited to see what that is. So I just thought I'd kind of give a bit of the kind of strategic view I've heard from people on some of this, but I'm really keen to hear people's questions and views. So I think, Phil, you asked about kind of how the process has been for people, any and anything you wanted to say about how it works for providers. It's Miriam, isn't it, with you?
Yes. Look, I mean, you know, when this exercise, you know, was first mooted, we weren't in the position we're in now. But, you know, at the same time, the pressure on providers is massive. And, you know, we saw our energy bill rise by something like 200%, and it's going to go up again. And that's just energy. And we're big sources of energy, you know, sorry, big users of energy. We have to be. We run 24/7 services. And, you know, and some of us, you know, have older buildings that are probably not as energy efficient as newer buildings, and there's all of that mix that goes on. And in my organisation, we've got a mix of very modern and some quite older buildings. So, you know, the food costs are just going through the roof, obviously, as well. I mean, you know, we've heard that there's a supplier that's just bought £1 million worth of cooking oil because he's just thinking, right, it's going to be 3 times as expensive and I better buy it now. I mean, there are all these cost pressures now in the system that we were certainly not anticipating when we set our budgets last year. And now setting our budgets this year is going to be, yeah, you know, it's going to be quite a frightening exercise. You know, some are not going to survive. They're not. You know, it's going to be really, I think, quite a difficult time. Yeah.
Yeah, and I hear you about the new pressures in particular.
And there's a lot of political uncertainty as well. So, you know, is this project going to survive? You know, I think is the other thing. There's a lot of mixed messages coming out from the candidates about what they're going to do, about a range of different things. Or what they're not going to do. So, yeah. So let's hope the work hasn't been in vain, eh?
Well, let's hope we get some more money, even if it's not enough. And I know Ali's made also a comment in the chat, and I know Ali's mic isn't working, so I thought I'd just speak to that one as well, and then we've got a couple of other hands. So in terms of paying London living wage, but feeling there's less wiggle room around travel time and other areas, so for home care sector. I mean, I think that is what the fair cost of care exercise, as much as it's a new burden to fill it, to complete it, it should shine a light on those other areas. And if we can also use it to share kind of between providers, you could see it starting to influence more in that way. But that's exactly what its purpose is for, is to show us if parts of the service model aren't properly funded currently. So I hope that will be helpful. In terms of 3 hands up currently, I think I've got is it Evgenia first? Sorry,
yes, it's Evgenia, that's fine. Hi, I'm Evgenia. I'm working for 2 care homes in North London. It's Autumn Gardens and Anastasia Lodge. We're 2 local care homes. I just wanted to add on what Miriam was saying, which is completely on point. Just to say that all of these changes are coming right after us trying to get out of a pandemic, and very unexpected and very not well handled for care homes, at least at the beginning of it. Pandemic, which we all know very well how badly affected care homes, how many care homes shut down because of it. And I can speak on behalf of 2 very small care homes, local care homes. It was really hard. It has been really hard on small care homes, and the fact that we survived is already big enough for us. So all these changes, on top of all the very good points Miriam made, I think if they had a budget in mind that they wanted to do all this, to have these changes within this budget, now we even need a way bigger budget because of this effect that the pandemic had on social care. That's all. But I think it's really important that we don't forget COVID, because it has affected us so severely.
Yeah, I agree completely. There's a gentleman who's waiting to speak. Sorry, your Teams just says Camden. So do you want to introduce yourself?
Hi. Yeah. They for whatever reason, it's not allowing me to change it on the top there, so I've just left it. It's Kola from Caremark Camden. Yeah, it's just in relation, just to add on to what everyone has said. I think it's quite important in terms of that, and also for the council as well to understand. If you look at it from the provider's perspective in terms of margins, then there's pretty much nothing in it. I mean, just to give you an example of the kind of costs, or just an idea what we've had to scale up as a result of the cost of living crisis, as well as the impact from the pandemic. My company, we've had to increase the care assistance hourly rates 4 times in the last 12 months. And if you consider the fact that you're increasing someone's hourly rate 4 times in the last 12 months, and whatever you're getting back in terms of the service you're providing is still pretty much the same, then at that point it gets to a situation where you're going, okay, there must be something from somewhere that should be able to counteract that, and hopefully the exercise would which I'm sure you all know before, or it's already highlighted the fact that there is the pay structure, the rate structures, I would say, would need to change, and at least to be reflective of what's going on in society now, because as you know now, because care generally is not paying as well as it should, a lot of people are having to leave care and then going to other places. Like someone said in the text message here, people are going into retail instead of care because they don't see what's there. And something else as well that's the impacts also having is an impact in recruitment as well, because and what you then get is you get providers who get people who are coming into their companies, and then because the pay is not as much as that one, they only stay for like 2 to 3 weeks and then they go to so it's creating quite a lot of instability within the sector. So I think if that in itself is then addressed, i.e. that fair cost of care is addressed and looked at, and a proper rate structure is put in place, that would then, think about the fact that, okay, look, in this day and age, we cannot then be saying, okay, we want to offer this service for this particular rate. Then I think it would even help in the long term in terms of the recruitment strategy that we're looking at.
Yeah, I think there's a lot of good points there. Jeffrey, you want to come in as well?
Hi, I think most of my colleagues have done a good job. They kind of said the kind of points I wanted to make. It's just to highlight, really, I think Miriam started and the rest caller and everybody's quite said it. The problem, care sector have had constant bashing right from COVID. I don't think we've quite recovered. Anyone in this forum would say, yes, we have, would be lying, because this is just from when we are starting to breathe. The cost of living crisis became an issue. And unfortunately, most of those models of saving costs does not apply to care, because you can't say switch off the lights or do this or that in order to save energy, because we need them running. And most of our care homes like mine have got so many pluggables for residents. Some of them are equipments that need to run on electricity and the rest of it. What I think, NCL has done a great job. I really appreciate the support we've had along from COVID till now, just having this conversation. If you are all politicians, you would all be hiding away from us, but you're actually engaging us. So I admire that. And as you engage us, I know previously we completed a fair course of care documentation. I don't know whether this is something we need to complete now on an ongoing basis, because inflation is predicted to rise almost month on until when it hits about 18% in January or February, as they talk about. But I guess my bit of question would be then, what does support looks like for a care home? Could it be that NCL may have to think about what are some of the key factors that will keep us running? I'm a bit lucky that I'm part of a large provider. Maybe another part of the industry might help plug mine and keep me running, but the small providers may not have this kind of choices. Some of them might get out of business. They'll go out of business and the people will need their services. So maybe it might help to think about whether there are some education, energy supplements to go into care homes to keep them running, because that's where I expect the cost to be highest at the moment. And all the other aspects as we go by. I'm not sure whether there is means to put something to plug the similar kind of supports we had around time COVID that was helping to promote retention, getting people back to work, covering sick pays around the COVID time. If something like that is available within the local authorities or NCL to help services, I think it will go a long way. I'm not just proposing that we need a cover up of the inflationary rise. I don't think that is realistic, but I think it's just some sort of goodwill. Unlike in my organization, to promote retention, we had to increase salaries for the nurses, for care staff. I had to start with all my key heads of departments because I needed them, even if everybody left. If I have my most trusted commanders next to me, we can still stay running. So that's the challenges, that's the service that we're really facing. And I know most people are in the same boat.
Yeah, I think there's I think people have made the points really eloquently. So I think there's, so I'm trying to think how to sum up because it's such a rich conversation. But over all of this, there's political uncertainty. I think we just need to kind of acknowledge that, work to make the case for more funding nationally, which we've been doing over recent years, and I know care providers have been doing it through national organisations as well, which is, I think, is helping, even if it's slow. I think there's a plea for every provider to put in your costs if you're part, if you're covered under the programme. Share your costs, because that's the best way we can get to an evidence base. I think what those costs will show is that there is pressure now that is far beyond the funding the councils are likely to get that's additional. So there will need to be decisions that each council will need to make about that. But obviously that doesn't mean, we uplift annually and have done for many years. So we're kind of used to doing those processes, and we're used to austerity. We're not used to this level of inflation. And I think some of the ideas around how we look at things like energy costs, we've been having those conversations and seeing what's possible. So I think we'll keep doing that. We'll need to work with you. What I can say in terms of a market is we're only seeing growing need for care. We don't want some parts of the country have care homes with occupancy that's much lower. That isn't the case in North Central London. And in terms of the dom care market, we're supporting more and more people at home for longer. And this is just, this is what happens with an aging population, isn't it? And the impact of the pandemic. So we don't want to lose providers. We want to work with providers to be to meet the needs of our residents as well as possible, and we need to understand the funding gap from the fair cost of care work to and then work out what we can do. But I just wanted to sort of reassure people that for us, we think we know our market is growing and needs to grow further. So we need to act within that, because otherwise we won't be able to meet the needs of residents. Miriam, I think you've just put your hand up.
Yes, just one other thing I just wanted to add. I mean, we talk about, we're used to talking about the impact that the recent crisis is having on fuel costs and, and food costs, etc. But something else to add to the mix and not forget is that some providers are going to be hit by increased interest costs, so on loans, etc. So and they're just going up. So as the cost of, based on the formula that the Bank of England uses, the interest rates are probably going to go up because it's going to be a hit against inflation. So, that's something else that some providers may well be facing. This won't be the case for everybody, but it will be an issue for some, and it's likely to be very significant for those people or those groups.
Yeah, no,
and there are a lot of quite big providers who are very heavily leveraged, and it may be the case for some smaller ones as well.
Yeah, no, I think that's a good point. So I'm going to suggest that we wrap up on fair cost of care there. Phil's slides kind of set out some of the key dates, but I think that one of the key messages was, if you haven't done a return yet, but you want to, there isn't long, but please do, because we want to get as many as possible. In terms of other parts of the agenda, just to kind of recap, we're looking for formal partners around the academy bid, and people who identify as formal partners. We'd want to work with you then about how we shape that bid and get the processes to influence our training providers, and get the kind of the recruits coming through, and trialing things like shorter placements and the sorts of training that you identified earlier. The workforce survey, the last one was so incredibly helpful. It was used across London, not just in North Central London. It helped us win several funding bids. So please do complete that. I'm really interested to see how it compares to last time, because that because of all the conversation we've just had, I think it may be quite telling, and we will share with you the report that I think will be helpful for people to use. And a reminder about if you're interested in partnering with the Prince's Trust project, then contact Ronca. Naomi, Phil, is there anything else that I should have said that I haven't?
I don't think so. Nathan's just put the link for the workforce survey on the side. Our emails should be in there as well. So yeah, just thank you to everyone, I guess.
And we're close to 60 returns, aren't we? And
yeah,
we're looking to get to 100, I think.
That would be great.
Sorry, Phil.
One small A or B, if that's okay, Richard.
Yeah, go for it.
So for care home buyers in particular, we've set up a co-production group at the moment, focusing around complex care home placements, potentially looking to widen the scope as time goes on. If anyone's interested in joining, I'll pop my email in the chat. Just drop me a line, have to have a conversation about it. Really keen to get as many people involved as possible.
Great, fantastic. So thank you very much for thank you everyone for your contributions. I thought that was a really great session, and we covered a lot of really important areas. So thank you, and we'll see you again in a couple of months, or if not before. And yeah, have a good week.
Right, thank you so much, everybody.
Thank you.
Thank you.
Thanks very
Bye.
much.
Bye.
Bye.
Thank you.
Bye.
Thanks, everyone. Bye.
Thank you.
Thanks
Bye.
all. Bye-bye.
Thank you. Bye-bye.
Richard, can you put your email on the chat, please?